TRT World Health Correspondent Nicola Hill joins me now from London. Nicola, I just want to understand how bigger news this is, if it really is such good news as I think it is. Because I look at the figures, as a lay person, this drug can save the life of 1 in 8 patients on a ventilator or 1 in 25 lives of those needing oxygen in intensive care. This might not look like much, but explain how big a breakthrough is this?
Oh, Maria, this is a real breakthrough. It's absolutely, I mean, the two men who announced this last night to the public here in the UK, Sir Patrick Vallance, who's the government scientific officer, and Professor Peter Horby, who's leading the trial, they said it's groundbreaking. And the reason why is until now, we've had nothing that actually saves lives in connection with COVID-19. This is the first treatment that actually is saving lives. Now, the actual figures, as you said, they might not look enormous, but if you think of the numbers of people who we've seen on those pictures on ventilators, it's cut the reduction of death to 28%. Normally, nearly half of the people in hospital on a ventilator in COVID-19 do die. So the fact that you are saving lives with a drug like this is just amazing. And, you know, I've been a health reporter for many years. To see scientists smile when they give such good news was quite unusual and really cheering, actually, that we have now got something. This drug it's dexamethasone, it's a steroid. It was discovered in 1957. It's one that's given to patients who have asthma, who have certain skin conditions, who have inflammation, and that's why they looked at it in this recovery trial. This is the trial that's looking at 6 existing drugs to see if they can be repurposed and if they can be given to patients in an attempt to cure, prevent, save lives for COVID-19. And they found that because it works against the inflammation, that's why it's effective. But I do have to say, Maria, this is effective for people who are seriously ill with COVID-19. It's the ones who have this cytokine storm that we've been talking about, where the body's own inflammation system has gone into overdrive. And that's where it seems to be the most effective. And the scientists are very pleased about that because, of course, there is nothing for those people. You know, if you have mild to moderate COVID-19 and you're at home, dexamethasone is not going to be effective. It doesn't prevent the disease and it doesn't help people who don't have these main lung problems. So it is for these people who are hospitalised and who until now have had absolutely nothing.
This really is great news for those people that are seriously ill. Nicola, what happens now? Because it costs only 50p, under $1, so it could get to everyone in the world that desperately needs this.
That's a really important point, actually, and it is something that the scientists have said. They figured that here in the UK, it's about £5, and they worked out that it's about £40 to save a life. That was the words that they actually used. For those people who are in third world countries, who obviously have been really worried that if we have found a treatment or a vaccine, would it be affordable? Or would there actually be enough of it? Now, because dexamethasone is so well used in other areas, because it's a steroid, most hospitals have it in their cupboards. So it's already readily available and it can be given to people in the poorer countries who can't afford the other treatments that are being looked at. One, for example, is remdesivir. That's the Gilead drug that we've all been hearing about. The research where that's involved is that it seems to reduce the recovery time. At the moment, there hasn't been any proof that it's saving lives in the same way that dexamethasone is doing. But of course, we don't know the cost of remdesivir, so is that going to be as easily available and as affordable for globally? But this drug really is. Dexamethasone is available, it's there for everybody. And what was interesting is that when the results were seen, because they were so good, they stopped recruiting for the trial because the doctors realised it was effective. Now, the WHO has welcomed the results and it said it will now look at the further details and then change its guidance accordingly. Lots of experts have been commenting on this news, welcoming the fact that we now seem to have something that is effective. of course, these are the top line results that have come out, and they were broadcast to us very quickly because it was great news. But we're now going to wait and see what the full details are, because the one thing that it didn't show was its effectiveness on people who were hospitalised but not needing oxygen. Now, the speculation, it might be because these people had an underlying health condition. We don't know. So there's going to be a much more of a deep dive into the science now, looking at this particular drug. And of course, the recovery trial, which looks at these 6 drugs that are used in other diseases at the moment, will report how it's looking on the other 5. We heard
Nicola,
just
we've
recently
run
that
out of time.
which was one of them.
I'm afraid we've run out of time, but it's great to end the show on such great news. I hope this is the first of much more good news on coronavirus. Thank you, Nicola.